Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Pharmacology. A 2-year-old child is receiving temporary total parental nutrition (TPN) through a central venous line. This is the first day of TPN therapy. Although all of the following nursing actions must be included in the plan of care of this child, which one would be a priority at this time? Option A. Use aseptic technique during dressing changes. Option B. Maintain central line catheter integrity. Option C. Monitor serum glucose levels. Option D. Check results of liver function tests. Right answer is Option C. Monitor serum glucose levels. Monitor serum glucose levels. Hyperglycemia may occur during the first day or two as the child adapts to the high glucose load of the TPN solution. Thus, a chief nursing responsibility is blood glucose testing. NursinG is administering the initial total parenteral nutrition solution to a client. Which of the following assessments requires the nurse's immediate attention? Option A. Temperature of 37.5 degrees Celsius. Option B. Urine output of 300 cc in 4 hours. Option C. Pour skin agar. Option D. Blood glucose of 350 milligrams. Right answer is Option D. Blood glucose of 350 milligrams. Total parenteral nutrition formulas contain dextrose in concentrations of 10% or greater to supply 20% to 50% of the total calories. Blood glucose levels should be checked every 4 to 6 hours. A sliding scale dose of insulin may be ordered to maintain the blood glucose level below 200 mg/dl. Nurse Susan administered intravenous gamma globulin to an 18-month-old child with AIDS. The parent asks why this medication is being given. What is the nurse's best response? Option A. It will slow down the replication of the virus. Option B. This medication will improve your child's overall health status. Option C. This medication is used to prevent bacterial infections. Option D. It will increase the effectiveness of the other medications your child receives. Right answer is Option C. This medication is used to prevent bacterial infections. Intravenous gamma globulin is given to help prevent as well as to fight bacterial infections in young children with AIDS. When caring for a client with total parenteral nutrition (TPN), what is the most important action on the part of the nurse? Option A. Record the number of stools per day. Option B. Maintain strict intake and output records. Option C. Sterile technique for dressing change at foresight. Option D. Monitor for cardiac arrhythmias. Right answer is Option C. Sterile technique for dressing change at foresight. Clients receiving TPN are very susceptible to infection. The concentrated glucose solutions are a good medium for bacterial growth. Strict sterile technique is crucial in preventing infection at 4 infusion site. The nurse is administering an intravenous vesicant chemotherapeutic agent to a client. Which assessment would require the nurse's immediate action? Option A. Stomatitis lesion in the mouth. Option B. Severe nausea and vomiting. Option C. Complaints of pain at site of infusion. Option D. A rash on the client's extremities. Right answer is Option C. Complaints of pain at site of infusion. A vesicant is a chemotherapeutic agent capable of causing blistering of tissues and possible tissue necrosis if there is extravasation. These agents are irritants which cause pain along the vein wall, with or without inflammation. Nurse Celine is caring for a client with clinical depression who is receiving a MOH inhibitor. When providing instructions about precautions with this medication, the nurse should instruct the client to: Option A. Avoid chocolate and cheese. Option B. Take frequent naps. Option C. Take the medication with milk. Option D. Avoid walking without assistance. Right answer is option A. Avoid chocolate and cheese. Foods high in tryptophan, tyramine and caffeine, such as chocolate and cheese, may precipitate hypertensive crisis. While providing home care to a client with congestive heart failure, the nurse is asked how long diuretics must be taken. The best response to this client should be option A. As you urinate more, you will need less medication to control fluid. Option B. You will have to take this medication for about a year. Option C. The medication must be continued so the fluid problem is controlled. Option D. Please talk to your physician about medications and treatments. Right answer is option C. The medication must be continued so the fluid problem is controlled. This is the most therapeutic response and gives the client accurate information. George, age 8, is admitted with rheumatic fever. Which clinical finding indicates to the nurse that George needs to continue taking the salicylates he had received at home? Option A. Chorea. Option B. Polyarthritis. Option C. Subcutaneous nodules. Option D. Erythema marginatum. Right answer is option B. Polyarthritis. Chorea is the restless and sudden aimless and irregular movements of the extremities suddenly seen in persons with rheumatic fever, especially girls. Polyarthritis is characterized by swollen, painful, hot joints that respond to salicylates. Subcutaneous nodules are non-tender swellings over bony prominences sometimes seen in persons with rheumatic fever. Erythema marginatum is a skin condition characterized by non-pruritic rash, affecting trunk and proximal extremities, seen in persons with rheumatic fever. A nurse has taught a client taking a xanthine bronchodilator about beverages to avoid. The nurse determines that the client understands the information if the client chooses which of the following beverages from the dietary menu. Option A. Chocolate milk. Option B. Cranberry juice. Option C. Coffee. Option D. Cola. Right answer is option B. Cranberry juice. Cola, coffee, and chocolate contain xanthine and should be avoided by the client taking a xanthine bronchodilator. This could lead to an increased incidence of cardiovascular and central nervous system side effects that can occur with the use of these types of bronchodilators. The nurse is aware that the patients who are allergic to intravenous contrast media are usually also allergic to which of the following products? Option A. Eggs. Option B. Shellfish. Option C. Soy. Option D. Acidic fruits. Right answer is option B. Shellfish. Some types of contrast media contain iodine as an ingredient. Shellfish also contains significant amounts of iodine. Therefore, a patient who is allergic to iodine will exhibit an allergic response to both iodine-containing contrast media and shellfish. These products do not contain iodine. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.